and we're going to go through what is the cuff. So the rotator cuff will have a little explanation about the anatomy of the muscles we're talking about, why it's so important, and if you ever see a physio for shoulder pain, they're probably going to mention the rotator cuff. And then Joe's going to demonstrate our 3 favourite exercises for strengthening and training the rotator cuff. Okay.
Thank you. All right, so going through the anatomy, the rotator cuff is 4 muscles, and the main job is to stabilise the humerus into the sockets, keep that ball in the socket, but each of these 4 muscles have an individual role as well. So when we're talking the supraspinatus, it aids in obviously stabilising, but then abduction, so nice and easy for you. And there's a bit of controversy at the moment about the true how much it does and where it does it, but just know it helps keep the ball into the socket in abduction, and then external rotation as well. And when we're thinking where is it, supraspinatus fossa, just in the scapula, and then goes all the way to the head of the humerus. This lovely picture demonstrates infraspinatus, just external rotation. It helps with just external rotation. And this is the infraspinatus fossa going into the head of the humerus as well. Then we're talking about teres minor. I put these 2 together because of those 2 are just doing external rotation. Teres minor, thinking about the lateral head of the scapula, edge of the scapula, apologies, to the head of the humerus. And this again is just doing that external rotation. And then subscapularis, the only one that does internal rotation. This is the infraspinatus fossa as well, but it goes to the head of the humerus. And we're thinking internal rotation, so more of like this opposite movement. That's internal rotation. And why is it so important? So Keith's going to go through why we care about the rotator cuff so much in our rehab throughout.
Thank you.
No problem.
Okay, so the rotator cuff are so important because the shoulder, you may have noticed, but shoulders generally have got quite a lot of movement in them, so they're really, really mobile joints. And it is a ball and socket joint, but the ball in the socket is quite mobile, so the ball can drift within the socket. Unlike the hip, so the socket is very tight around the hip joint. It's more of rather than a tight socket, it's more like a pasta bowl, so it's a little bit shallower. And the thing that keeps the ball from not drifting too far to the edges is the rotator cuff. So we call it a dynamic stability. And you could consider the cuff muscles. So the muscles that Joe went through, when they work together, they're effectively the core stability muscles for the shoulder. Everyone's familiar with core stability when we talk about the back, but this can be seen as the core stability of the shoulder. And they are involved in every movement. So whatever movement you're planning to move or strengthen, whatever function you're doing, the rotator cuff muscles as a group will be active. So they will be functioning to maintain the stability in the shoulder to allow some of the other stronger muscles to then create the movement. And the dysfunction, so if they're not working in the right way, that can lead to injuries. So if they're not working in the right way, the ball within the socket can just go to the edges, and then it can damage or irritate the shoulder joint, and that can lead to pain. And pain and injury can then inhibit the rotator cuff from working, and then you get into a little bit of a vicious circle. And that's where we have to sort of pick through things to try and work out what's going on to try and increase the stability of the shoulder again. So you can see the rotator cuff, when they're working together, they're a little bit like a section of an orchestra. So if you've got your violins, you've got to make sure that they're all playing at the right volume, but also they're playing at the right time. So if you're thinking of lifting something up using all of your shoulder muscles, the rotator cuff are a really integral part of that function. And we need to make sure the timing, the strength, or the volume, if you like, is working to the optimum. Okay.
Ooh.
Right, Joe.
Exercise time.
For you.
So
let me do I'll move the camera in a moment. One sec.
No problem at all.
Excuse me.
Before we get into the exercises, I want to make it clear that we shouldn't just think, okay, these are the exercises for a rotator cuff, shoulder hurts, I'm going to do it. These are ones that we normally use and they're a core exercise and they're brilliant, but you want to make sure with a therapist or the GP, just make sure that these are appropriate for your injury, and it's not always a one size fits all. So just I like a bit of clarification, a little bit of you know, don't just do these automatically and then do as many as you want. See someone about it, hopefully yes, but see someone about it and actually get the right prescribed for your shoulder. All right, that's my boring admin stuff out of the way. The making sure everyone's actually okay. So W band external rotation. Well, I like this one. You tend to use this at the start. So kind of think of a W. So we know most of the rotator cuff muscles, 3 of them are doing external rotation. And what I like to do is just do a static hold to begin with. This is very early stage. You see my arms are already shaking. I've got no shoulder problem. So it's quite a nice exercise to do to start strengthening that rotator cuff properly. Again, one more time. So I like kind of do a hold, 5 seconds, 2, 3, 4, 5, and then nice and relax. It's a good early stage exercise just to start building that strength up. Second one, we're thinking more about strength of the external and internal rotation with movement. So this one is, I like this one, nice dumbbell one. Thinking we know internal rotations this way, external rotations this way. There's a movement of the shoulder as well. So putting the elbow into the knee, nice controlled, bring it down. And if we're able to, bring it back up. Nice, easy exercise. It can be accessible, but this is going for more mid stage of the rotator cuff because we're adding in abduction into this position, external rotation, internal rotation, actually the shoulder moving in function. And then the last one we're thinking at last stage, because the main thing of the rotator cuff, as we went through earlier, is stability. So we don't want to forget about stability, especially towards the latter stage. So the lovely kettlebell press. It's important. I tell people all the time, don't put your thumb on here and cheat, because that just adds to stability. We just want to do a simple bench press, nice and slow. You can see it shaking, that's what we want. That's what we know, is keeping the stability high. Nice and slow, and nicely slowly up. We're trying to keep as much stability as possible. So we want to be smooth coming down, as smooth as it is going up, and then this further can go into power. But that is for stability for the rotator cuff. Before we do it, any questions